Can a sickle cell patient live a long life? In this video, I am giving an update about my health 4 years later and addressing some myths about sickle cell anemia. Watch till the end and let me know in the comment section what questions about sickle cell you would like me to answer. It's 2026 and I'm still here, still relatively healthy, still not in and out of the hospital. I live with sickle cell disease. I'm turning 50 this year and I want to talk honestly about what has helped me stay well and some myths that people still believe that actually hurt patients. This is not medical advice. This is my lived experience, shared to educate and encourage, especially if you've ever been told that sickle cell automatically means suffering. Years ago, I made a video called How to Live a Long Life with Sickle Cell. In that video, I talked about lifestyle, self awareness, medical care, and avoiding triggers, not as a theory, but as survival skills. This video is not replacing that message. This is the continuation of it. Since that video, people have asked me, are you still doing well? Did you get a bone marrow transplant? Does lifestyle really make a difference long term? So this video is an update from where I was then, about 4 years ago, to where I am now in 2026. As of now, I'm still relatively healthy. I don't have frequent major pain crises that require hospital admissions. I still live with sickle cell, but it is managed, not unmanaged, and that distinction matters. Sickle cell doesn't look the same for everyone, and it doesn't stay the same throughout your life. Recently, I was scheduled for a bone marrow transplant. Many people see that as the cure, but the reality is much more complex. In my case, I only had a half match donor. I'm older now, I'll turn 50 this year, and the potential complications during recovery were significant. After careful consideration with my medical team, I decided not to proceed. That decision wasn't about fear, it was about risk versus quality of life. And this is where my earlier video matters. The same principles I talked about in how to live a long life with sickle cell anemia are still what I rely on today. Not because I avoid medical care, but because I learned how to work with my body and my medical team. So, myth number one, you can't live well without a cure. This myth is harmful. A cure is one option, not the only path to stability or dignity. Right now, I manage my health through ongoing medical care, lifestyle choices, and strict avoidance of my known triggers. And for me, that combination has worked. If you've watched my older videos, you will notice something. I'm not saying anything drastically new. I'm saying it with more years of experience behind it. So here are the things that have helped me and continue to help me over the years. Number one, avoiding triggers. Cold exposure, dehydration, extreme stress, overexertion. I don't ignore these anymore. I respect my body. Overexertion is one of my biggest triggers. When I overwork myself, it goes without doubt that I start getting sick. So I'm learning to pace myself. Number two, hydration and nutrition. This isn't trendy wellness talk. Hydration and nutrition matter deeply for our blood flow and for pain prevention. Number three, early responses. I don't wait until my pain becomes a full blown crisis. I respond early by taking my pain medication, resting, pacing myself, drinking lots of fluids, and so on and so forth. Number four, my medical team care. Lifestyle alone does not replace doctors. Lifestyle works alongside them. Myth number two, if you're doing well, you must not have sickle cell. This one hurts. People assume you are exaggerating if you are sick or you are lying if you're well, but both are wrong. Sickle cell is not a constant emergency, but it is a constant condition. When we only show suffering, we unintentionally teach people that sickle cell equals hopelessness. But when we show management, adaptation, and reality, we create space for better self advocacy, earlier intervention, and more humane care. If you're watching this and thinking, that's not my experience, that's okay. Your journey is valid. Whether you're stable, struggling, or somewhere in between, the goal isn't perfection, it's sustainability. This is not medical advice. Always work with your healthcare provider to make decisions for your health. I'm sharing what has helped me, not what everyone must do. If you are new here and you haven't watched How to Live a Long Life with Sickle Cell, I strongly recommend watching that next. That video explains the foundation. This one shows you what it looks like years later. Together, they tell the full story. If this video helped you feel seen, informed, or less alone, let me know in the comments. And if you live with sickle cell, let me know what has helped you stay well. You are not alone, and your life is not defined only by your diagnosis. If you want more honest conversations about living with sickle cell, subscribe. I'm still here. Let me know what topics you would like me to talk about.